Hello, my name's Tracy Goodman. I'm a patient services coordinator for the AF Association. Today with me, I've got John Bailey. He is very kindly offering to share his AF journey with us. And we've got some questions that we're going to ask John, and hopefully his experience will be able to help you and support you in your diagnosis as well. So good morning, John. Welcome to our recording today.
Good morning, nice to see you.
John, just to confirm that you are 69 and you're based in Elephant and Castle in London, is that correct?
That's correct, yeah.
Lovely. So I'm just going to start with one of the questions, John. So when were you diagnosed with AF?
16th of June this year, that's 2020. Yeah, I just didn't feel quite right that day. I felt a little bit unwell. I usually go for a run. It was a Tuesday, and I just didn't feel up to it. And I thought I was short of breath, and I thought, why is this? And I've just never really liked that. So I took my pulse. I used to be a nurse, so I took my pulse, and it wasn't a proper pulse. It was very erratic. It was well, it just wasn't beating, it was just sort of fluttering. So I thought that would go eventually. So I thought, shall I go for a run? So I got my gear on, still short of breath. And I thought, if I go for a run, because I've had something similar before, but nothing like this. It usually corrects, like when I used to do distance running, it would sort of correct itself after a while. So I thought I'd go for a run, but it wasn't a run, it was more like a crawl. And when I got back, it didn't get better. So by lunchtime, I took myself to the hospital. They did an ECG and diagnosed AF.
Okay. Did you have any other sort of heart palpitations or dizziness or anything else?
On that day I did, yeah, I just felt really rotten, and that's why I couldn't understand why. I knew it wasn't the virus or anything like that, because I thought I'd had that weeks or months before, but it just wasn't. It wasn't. There were no sort of fast palpitations, but it was just this fluttering. My heart wasn't beating properly, and that's why I thought. Obviously, I wasn't breathing. I wasn't getting my oxygen into me, but it was just really severe at that time. And when I used to run long distances, I would sort of have to stop occasionally because I would get this sort of, then it was not palpitation, but very fast heartbeat, and unnaturally fast. So I would stop for just a minute or two. It would clear, and then I would carry on. So that's why I went for a run that day, thinking that this would clear, but it never did. So I took myself to the hospital, and they diagnosed it.
Okay, so fortunately your medical history and your experience was able to assist you and know that something wasn't quite right. Was that correct?
Yeah, well, I do. I have had heart problems in the past. Got familial hypercholesterolemia, so I've got a family history of high cholesterol. And there's not a lot I can do about that, but I take very high dose of statins. My diet's good, so I've got a couple of stents in my heart, but I do sort of normal things. So it's not held me back at all. I just feel as though the statins sort of protect me.
Thank you, thank you. So how has your diagnosis changed or affected your life in any way?
It's made me more aware of what I should be doing. As soon as I left the hospital, though, that day, he was going to refer me to cardiologist and all that business. But the doctor said carry on running. So I thought, well, I will carry on running because I just love that. Not that I can run far now, but so it's not changed a great deal. Although since I've been on the anti-coag therapy, I was very blasé in the garden. I would chop things down and climb trees and that, but I'm a little bit more careful. And I do wear long sleeves in case I bleed and that. But I'm not really, because I think this is paroxysmal AF, so I've not got it all the time. But I get it. I've only had it twice, like it was that day. But I do get it occasionally when my heart is not beating properly and I'm slightly short of breath. So I just sort of take care really, and I've not changed a great deal. Still eat and drink and exercise. No, not a lot of alcohol, but
Yeah.
I'm reasonably fit.
Thank you, John. So what treatment options did you choose? What helps you manage your episodes?
Well, I wasn't really given a choice because I've not seen a cardiologist yet. when I left the hospital, before I left, he said, right, we'll put you on warfarin and beta blockers. With the heart trouble before, because I've always been a runner, my pulse is very low. So when I go on beta blockers, it goes lower. And in the past, it was 35, and I just felt so unwell with my pulse being that low. So I didn't want to go on beta blockers. So, and being a nurse, I know the problems of warfarin. So I thought, if I'm going to see a cardiologist, I'll decline that for the time being. Anyway, I didn't see a cardiologist, still haven't seen a cardiologist. So I contacted my GP, and he said I should go on anticoag, and now they don't use warfarin so much, so I'm on edoxaban, and that seems to be going very well with me. So I've not been given the choice. They did talk about ablation and that sort of thing, but I'm not sure if it'd be suitable for somebody with my type of AF.
Okay, and obviously you'll be guided by the medical professionals for any procedures like that in the future.
Yeah, I'd like to come off the medication, but that's possibly something. I don't worry about taking it forever. It's just one of those things. But when I was 15, before I had the previous heart problem, I was on no medication at all, and now I sort of go for a run and rattle. But never mind.
Okay. So you say you haven't made any lifestyle changes. You've pretty much kept everything the same. You do your running and your exercise.
Yeah, I must admit though, since I had these 2 bad bouts, I've been very tired and a bit slower. So I'm not like this morning. I should have gone for a run, although it was raining, so I didn't go. But in the past, nothing would stop me. I would sort of go out, just put the wet gear on and go out. But
Okay.
perhaps it's just getting old though.
And what advice would you give to somebody that's newly diagnosed with AF as well?
Not to worry. It does seem, if you hear other people being on sort of the warfarin, that sort of medication, you think, oh, it's a big deal. But it's not really a big deal. You can carry on doing almost everything. And exercise is important, all right? Don't go too mad, but get advice from your GP or your cardiologist and carry on with exercise, watch your diet, that sort of thing. But don't worry about it. It's I know people, having been a nurse in their 80s, have had it for many, many years and are still carrying on. So fingers crossed.
Absolutely. How has the AF Association helped you, John, in your journey?
Yeah, well, I got this little booklet, and that's explained lots of things to me. Like I read through that, and it sort of answered a lot of questions, and it's good knowing that they're there. There's somebody to contact, like any sort of problem. If there's somebody to speak to about these things, or just look at this AF Day, Patients Day. I looked on there, and they were doing discussions and that, and it was good going through theirs. I never completed them all, but I think there's still time. But it was good going through their experiences and their advice and the expert advice. Really, it's better to get it from somebody who knows what they're talking about. So
you mentioned our patients.
Sorry, carry on.
You mentioned our Patients Day, which is our virtual event that we launched this year, and you found that of benefit.
Yeah, I found it really good. Yeah,
people visit that website and have a little look at that.
Yeah, particularly the as I said, the experts talking about their experiences and their treatments, and that it was really useful.
Yes, well, good. That's very good to know. Do you think that you've had many challenges of living with AF? Have you faced new challenges at all?
Yeah, well, it's the not knowing really. When I go for family said, no, you should take ID with you. I never have, but perhaps I should. But then I'm not sure. The doctor at the hospital said carry on running. So I think your heart is a muscle, and if I don't exercise it, then it could possibly suffer. So I'm just hoping that possibly I'll see a cardiologist fairly soon, and they can give me advice. Possibly there's no need to see one, but I would just like to know the options of, are there any options? Why I've got AF? Is it because I'm the only one, 6 children there were, I'm the only one who never smoked. I'm the only one who's done a lot of exercise. I'm the only one who's got heart trouble. So just luck of the draw, really.
Okay. Well, let's hope that you get the answers that you need from the medical professionals soon, John. Obviously, with this pandemic at the moment that we're going through, things are taking a little bit longer to process, aren't they? So
Yeah.
fingers crossed that you'll get your answers soon.
Yeah, I think that is a problem. The pandemic has slowed everything up, but you just have to be patient for most things, really.
Thank you. So thank you for sharing your story with us, John, and we hope that you are feeling well at the moment and continue through your journey with us. And obviously, please don't hesitate to contact us if there's anything else that we can do to support you. And in the meantime, I just want to say thank you very much, wish you well and stay safe.
Lovely. Thanks for being there.
Okay.